Go ahead, open your medicine cabinet. I'll bet there's a good chance you'll find this exact pill. It's one of the most common over-the-counter drugs on the entire planet. But behind that familiar pink coating lies a hidden story, one of surprising power and some really unexpected dangers.
We take it for allergies, we take it to help us sleep, for a cold. But what's actually happening inside our bodies when we swallow it? What are its hidden powers? And maybe more importantly, what are its unseen dangers? Well, that's exactly what we're going to uncover.
So the scientific name is Diphenhydramine. But let's be real, you almost certainly know it by one of its famous brand names, whether it's that pink pill for allergies, the blue one for sleep, or an ingredient in your go-to nighttime cold medicine, it's all the same active chemical doing the work.
Okay, so before we dive into the hidden stuff, let's just start with what we think we know. What exactly is this drug that's become such a staple in our homes?
It's officially called a first-generation antihistamine. Now, that first-generation part is super important. It basically means it's one of the originals, a real pioneer, developed all the way back in the 1940s. The fact that it's still everywhere today just shows how effective it is, but as we're about to see, its age is also the reason behind some of its biggest side effects.
So, how does this little pill actually work its magic? To get a handle on the drug, we first gotta understand what it's up against inside our bodies.
Okay, so when you have an allergic reaction, your body goes into overdrive and releases a chemical called histamine. The easiest way to think about histamine is like a key. This little key floats around, and it's looking for a very specific lock on your cells, called a receptor. And when that key finds the lock and turns it, bam! You get all those miserable allergy symptoms, the itching, the sneezing, the whole shebang.
So this is where diphenhydramine comes in to save the day. It's actually pretty clever and simple. It basically gets to the lock first and just plugs up the keyhole. It physically stops that histamine key from ever getting into the receptor lock. If the key can't get in, it can't unlock the symptoms. Problem solved.
But here's the plot twist. Blocking histamine? That's not the only thing it does. Diphenhydramine has this powerful dual personality. On one side, you have that antihistamine effect we want, but on the other, you've got something called an anticholinergic effect. This means it also blocks another major chemical messenger in your body. And that second action, well, that's responsible for most of its other uses and its most serious side effects. Here's why this drug is so darn potent. Unlike the newer antihistamines, diphenhydramine is like a master of disguise. It easily crosses the superprotective blood-brain barrier and waltzes right into your central nervous system. Once it's in your brain, it doesn't just block the histamine receptors, which is what causes that signature drowsiness, it also blocks another set of receptors, called muscarinic receptors. This action is what can lead to confusion and doubles down on the sedation. This activity in the brain, it's the secret to everything else about this drug.
And because of these really powerful effects on the brain, diphenhydramine has a surprisingly wide range of medical uses that go way beyond just a stuffy nose.
These are the uses you'll see right on the box, right? Of course, allergies. Its knack for making you sleepy makes it a no-brainer for insomnia, and its effects on the brain also make it really good for stopping motion sickness and even quieting a cough.
But that's not where the story ends. Not even close. That other personality, its potent anticholinergic side, has given it some very serious and frankly pretty surprising off-label uses.
Get this. In hospitals, it's used to help manage the tremors that come with Parkinson's disease. It's also used to treat these severe muscle contractions that can be a side effect of some antipsychotic meds. And of course, it's the PM in so many cold medicines, pairing its sedative power with a pain reliever to help you get some rest. This isn't just a simple allergy pill, it's a powerful neurological drug.
And that kind of power, well, it comes with some significant risks. This is the part of the story that we tend to overlook when we just casually grab that box off the shelf.
A lot of these probably sound familiar. That intense drowsiness, the dizziness, that all comes from its action in the brain. But the dry mouth, the blurred vision, the constipation, yep, those are the classic anticholinergic side effects we were talking about. It's literally drying you out from the inside. And this is exactly why you should never, ever drive or use heavy machinery after taking it.
Now, these risks are not the same for everybody. For older adults, they are dramatically higher. There's an authoritative medical guide called the Beers Criteria, and it specifically warns against using this drug in the elderly. The risk of serious confusion, delirium, and really dangerous falls is just too high.
And for kids, it's a completely different story. You think it would make them sleepy, right?
Well, for some kids, it does the exact opposite. It's called a paradoxical reaction, and it can cause hyperactivity and agitation. This is why you have to be so careful with it, and why it's never recommended for kids under 2 years old.
If someone takes way too much in a severe overdose, the effects are captured by this pretty chilling medical saying. It describes what happens with extreme anticholinergic toxicity. Flushed red skin, severe dryness, pupils so dilated they cause blindness, delirium and hallucinations, and a dangerously high fever. It's a really stark reminder of just how potent this drug is.
Okay, I need to be absolutely crystal clear on this next point, because this is the most important warning of all. Diphenhydramine is a central nervous system depressant. Combining it with other depressants, like alcohol or sedatives or opioids, is incredibly dangerous. The effects stack on top of each other and can easily cause your body's breathing reflex to just shut down. That can lead to a coma or even death.
Okay, after all of that heavy stuff, how do we approach this super common medication safely and responsibly? What's the right way to think about it? It really just comes down to 3 simple rules. First, always read the label. Know the right dose and check for other active ingredients, especially in those combo cold medicines. Second, be super aware of what you're combining it with, especially alcohol. And third, when in doubt, just ask. Talk to a doctor or a pharmacist. It's that simple.
And here's the good news. For everyday allergies, we now have much better options. You've seen them, the newer second-generation antihistamines like loratadine or cetirizine. The key difference? They don't cross that blood-brain barrier nearly as much. This means they can treat your allergy symptoms without that heavy hit of sedation and brain fog. For daytime allergy relief, they're a much safer choice.
So, we've come full circle. This little pill is a fascinating piece of pharmaceutical history. It's a versatile, effective tool, but it's also a potent drug that really demands our respect and understanding. So, knowing its dual nature, its hidden uses, and its very real dangers, the question is, how will you see it the next time you open your medicine cabinet?